We are updating and raising awareness about COVID-19, the coronavirus pandemic that has truly hit our nation and many other countries in the world. Joining us again for a follow-up interview, we have with us Dr. Tushar Patel, a leading medical professional who is joining us via Skype from New Jersey. Dr. Patel, thank you so much for being with us here on ITV Gold.
Thank you so much, Aditi, for doing this again, for this wonderful information for our audience.
Yes, definitely. We are the South Asian news segment. We go, live every single night. So it's important for us to bring forth some really important issues. And right now, the entire country is only discussing the COVID-19 crisis and how primarily right now the entire tri-state is shut down. Parts of the country is also on a lockdown, and there's so much concern regarding what is causing this virus and how can we truly stop the spread. So, beginning this interview with you, doctor, I have to ask you, currently these three words, stay, stop, and save, have become a narrative that we keep on seeing everywhere. Stay home, stop the spread, save lives. Question to you, do you agree with this, and your comments and sentiments on what's happened since last week?
Absolutely. I agree with you, Aditi. And the most important thing, this is the second week on slow the spread of coronavirus COVID-19 disease in the country. And tri-state, New York and New Jersey are number one and number two states in the entire nation. So my message to everyone is very loud and clear. Stay home and restrict activities outside your home, except if you are acutely sick and need to go see your doctor or your provider.
Right.
And the essential workers, those fall into category of medical, paramedical professionals, pharmacy owner, law enforcement officers, postal workers. Those people needs to go to work. Everyone else should stay home and follow the state government guidance on keeping the safe distancing and reduce the spread of the current pandemic going on in the country.
Yes. And doctor, just discussing more on this pandemic, I kind of want to start and bring in the perspective of medical equipment. Currently, this entire week, we keep on hearing about lack of medical supplies, how these masks that we were talking about that the audience or normal public wanted to wear, these have become essential units. A lot of doctors are complaining about having to reuse masks. They're saying there are not enough ventilators. They're saying that there are not enough beds in this country. Your questions, concerns, and also comments on this entire issue, since you are a medical professional?
So definitely there is a huge concern about the acute care bed, especially these medical supplies and especially the ventilators. And according to the latest information from FEMA, Federal Emergency Management System, has started delivering medical supplies to hard-hit areas, especially New York, Washington State, California. And I think the construction companies and some other manufacturing companies who does other productions, they have started making the mask, making the ventilators, manufacturing the ventilators. And I think the other companies, medical supply companies, started donating the supplies to the FEMA and other states. So I think within next few days to next week or so, I think we will see the less scarcity of the medical supplies, especially the ventilators. And I think the federal government and the state government, especially in New York and New Jersey, they are working on making hospitals like Jacob Javits Center will be the new hospital for 1,000 bed.
Which they already started already. Yeah, the Javits Center has already been started as we speak.
Acutely ill patients.
Yes. Just in terms of the Javits Center, as we were just speaking about, doctor, and also in terms of these pop-up hospitals, we were reading statements by the governor of New Jersey, who has asked, for federal aid and federal support for these pop-up hospitals. We are seeing the Javits Center in New York City turn into a facility as well. Your comments on the need of the hour for these additional spaces, and how alarming should the audience be when they are hearing about this right now?
I think we need to be prepared for this kind of things. Not only the Jacob Javits Center or the big convention centers, but I think the schools, the probably some of the big areas where we don't use it, like a school gym or auditoriums. I think those are the areas probably we may need to consider, and we should not be getting alarmed by this, because I think that's normal part of the response. If we don't have acute care bed, and if we need to take care of the sick patients where we need to put the ventilator or oxygen, I think those are the areas we need to concentrate and ensure that the patients are safe, and we don't overcrowd the current hospital system or the staffing.
I believe the concern here is just last week, a lot of us didn't have to worry about our own parents, getting coronavirus, or our own loved ones in a certain age group. And, over the weekend and this week, with so many massive changes with the increase of cases, one is wondering how bad is the situation going to get when we are requiring extra beds? We need more ventilators. There are not enough masks. And also, should, now the public, when it gets really, really sick, should they now go to the ER for any symptoms they have? Your comments on that entire situation and how we should honestly understand it.
So most people, which are about 80% of people, who gets COVID-19 infection, who are under 60 years of age without any pre-existing medical conditions such as heart, lung, or kidney disease or diabetes, they will fully recover without any treatments. Just symptomatic treatment, taking acetaminophen or Tylenol or the over-the-counter medications. The key thing is, for those individuals, they need to keep themselves isolated if they have infection. If they have elder parents or elder grandparents home, they need to isolate themselves, ensure they cover their cough and sneezes, and wear the face mask for those sick people, and avoid sharing personal household items. I think those are the steps they need to take if they are sick. No concerns for those healthy individuals. When the elderly, 60, 70, 80 years old parents and grandparents get sick, they need to ensure that they call their primary care provider first. Do not rush into the emergency room. Do not rush into the provider's office, because I think they will definitely violate the policy of state government as well as the hospital and infect more people. So I think we need to ensure that if someone is sick with fever, cough, sore throat, or difficulty in breathing, they need to ensure that they call their provider first, because they drive to their provider's office or the hospital.